Bismillah ar-Rahman ar-Rahim. Hi and good evening, everyone. This is Abadar Al-Qaisi, the operation head of Merck in Iraq. It gives me great pleasure to be here with you and to start this meeting on behalf of Merck. And I would like to express my appreciation to you for being here with us in this meeting. We in Merck recognizing the role of pharmacists in the healthcare system setup of our country, especially in this critical period. We as pharmacists hold the responsibility to deliver effective, safe, and quality medicine and quality services to achieve optimal health outcome. So, welcome to this event and wish you fruitful and successful meeting. I don't want to take a lot of your time. And I would like also to extend my deepest thanks and appreciation to our esteemed speakers today, Professor Harry Howlett from UK and Professor Haidar At-Tukmachi from Iraq. And on behalf of all of you, I'm inviting the first speaker, Dr. Haidar At-Tukmachi, to start the presentation. Thank you once more time.
Okay. Can I start now?
Yes, please, Dr. Haidar.
Okay, thank you very much, Abadar Al-Qaisi. Bismillah ar-Rahman ar-Rahim. Hello, everybody. Nice to meet you online, Professor Harry. I hope you all in a good health, and may Allah push away the coronavirus from you, from your families, from your beloved ones, and from your country. First, I'm very grateful for Merck Company to give me this opportunity. I'm a pharmacist and proud to be a pharmacist. And nowadays, during the pandemic, I'm very proud to be a pharmacist. This is the real time. This is our time to let the world know who is the pharmacist and what is the role, the vital role of the pharmacist in saving lives, and what are we doing during our career. I can say that our job or our mission in our job today during battling COVID-19 is within 4 important duties. They seem to be so simple, but actually this simplicity is the source of danger. And let me please, Merck, speak just a little bit Arabic, okay, during this presentation. أعزائي, سهولة المرض، سهولة انتقاله وسهولة الوقاية من عنده هي مصدر الخطورة في هذا المرض، وهذه نقطة مهمة جدا يجب أن ننتبه عليها حتى لا نتهاون. So, those 4 duties: advising, educating, protecting, supplying. Those 4 duties must be done in a suitable language according to everyone's literacy, using the correct terminology for each one, from a poor culture worker and ending with a senior physician, just to reach the information to everyone. First duty is advising. A part of usual job, daily job in our career is advising healthy people and patients. And now our mission become more essential, very essential, to make the people aware of what's going on. And this is because what? This is because different things. First, pharmacists are the first point of contact between people and the healthcare professionals. Also, patients and healthy people can enter any community pharmacy without an appointment to get any information and reliable advice. Community pharmacies are providing high quality, reliable information to the general public, avoiding unnecessary scares and relieving pressure on the rest of the healthcare system. Those advices depend on the standard international and local guidance like FIP and Iraqi Pharmacy Syndicate. So, concerning my country, Iraq, the Iraqi Pharmacy Syndicate is the first community association that published thousands of brochures and stickers concerning showing advices for how to protect ourselves and how to protect the public And we can see in this slide, those are brochures that published by the syndicate at the first time of pandemic and distributed to pharmacies and in social media. The availability knowledge about COVID-19 is rapidly changing. So, although FIP will strive to keep these guidelines up to date, but we have as pharmacists, we have to be ready for any unexpected storm. This is very important point, and this is our job today. Okay. Concerning the second mission for pharmacists today is educating. Although educating people is a routine work of pharmacist's job, but with COVID-19, the outbreak is during the outbreak, the duty of educating is duplicated due to the following. Why we duplicate our efforts? It is a novel virus with a new infectious disease. No enough available information. There is a global wave of horror and huge fake news and posts. So, the pharmacists have to educate people depending on their scientific background and the new information they got, as the pharmacists are one of the white army nowadays against the COVID-19. Educating people about what do they hear and what do they read about COVID-19. This is the most important point, because all people nowadays are stay at home, okay, and searching web and try to find anything concerning the COVID-19, concerning the protection, the prophylaxis, and even the treatment. So this is not wrong for pharmacists to give some information, even with new information about the treatment, about the possible treatment, because as all of us know that till now there is no fixed treatment for COVID-19. So, also for protection, which is the third mission for pharmacists, is the protecting. We can say that the golden statement that used by the pharmacists in educating and advising people is prophylactic strategies push the virus away from you. So, promoting disease prevention and promoting infection control. This is a vital role for pharmacists during the pandemic. Pharmacists must advise and educate people and healthcare providers to protect themselves and protect others. This is not a simple mission because of very wide spread of virus that its ability to remain contagious for hours and even days. أعزائي، هاي نقاط مهمة جدا احنا يجب أن نهتم بها ولا نعتبرها شيء بسيط أبدا، لأنه إذا أخطأنا احنا هذا العدو ما نشوفه، هذا الفيروس الصغير نعتبره في شيء بسيط، فنتوقع بأنه الأمور بسيطة ونقدر نتوقع من عنده. Okay, so let's talk about personal protecting equipments, PPE. People around the world can be divided into 4 parts. يعني احنا أنا أقدر أقسم العالم إلى الناس إلى 4 أقسام. People know what are PPE and how can they use them. People know what are PPE and do not know how to use them. People just heard about those equipments, but in fact, never saw them. And finally, people never heard about something called PPE. This is a real problem, and we must put in our mind. The majority of people is from 2, 2nd, 3rd, 4th groups. So it is not simple as selling PPE and that's all. يعني احنا ليس احنا واجبنا اني فقط اجيب مواد بروتكتر. اوكي سوري، انا مو مجرد اني اجيب مواد حتى تمنع انتقال المرض واعتبرها هي من ابيعها للبيشنت او ابيعها للهيلثي people اقول له حط الماسك وفي مال لا. this is wrong way. Okay, Using them and discard them after using need learning and educating to ensure good protection. For example, people will feel comfortable just to wear those PPE, okay, gloves, masks, and satisfies themselves that they are doing the correct or the good protection. But in fact, you can see that people, even from the medical staff, wearing PPE in a wrong way, and also may take them off in a wrong way that may lead to spread of the infection. أعزائي, let's speak in Arabic. يعني إحنا نعرف إن السيرجيكال ماسك هذا أبسط شيء من الممكن أن نقدر نرتديه ونقول للعالم أن to be for prophylaxis for protection. أوكي, يعرف البيشنت بأنه أكو هارد إيج يجب أن توقف على الأنف. يعرف بأنه أكو نوع، مثلا هذا نوعين، هذا نوع واحد بنفس اللون أبيض بأبيض، لكن أكو اللي أزرق وأبيض. يعرف بأنه يجب أن يكون الأزرق هو للخارج for outward. هذين نقاط نعتبرها بسيطة، بس المواطن هو مش مدري على العموم. طيب, for example, sorry, those are very important points. In addition, people and even medical staff do not know the differences between face mask types. هاي أيضا نقطة مهمة جدا. يجيك البيشنت للصيدلية ويريد يقول لك أنا أريد ماسك N95. هو شنو ال N95؟ هو ما يعرف شنو N95. Okay. Those are types of face mask. We have to educate people that N95 is a mask type, not a brand one. Because some people say that they will not take mask unless they find the N95 label on the mask. وهذه حادثة حصلت معي، انه اجى واحد للصيدلية وهو من الميديكال ستاف، قال لي أنا جاب لي هذا الماسك اللي هو الهونيويل اللي قاعد تشوفوه بالسلايد. الهونيويل هو from the type of N95. قال لي أنا ما أريد هذا، بكي تدبر لي أريد الماسك اللي هو N95. قلت له هذا N95. قال لي لا، هذا كان كتب عليه N95. فهذه معلومات تعتبرها أنت بسيطة، لكن هي مهمة جدا، يجب أن نثقف الناس. This is a type of face mask, not a brand name, the N95. Okay. We have to learn people that N95 mask is intended only for healthcare workers and patient carers, not for other people. أنا ما يجيني أي واحد وأقول له أخذ N95. غلط وحرام. Okay. طيب. We have also to learn people that we have different codes for the mask. N95, N99, P95. Okay. Okay. We have to educate the medical staff to be sure that N95 mask must be fitted on the face to prevent any gap. Okay. We have to educate people that with chronic respiratory, cardiac, or other medical conditions that make breathing difficult should check with their healthcare provider before using N95 respirator. يعني احنا اذا يجيك بيشنت هو خايف على روحه، يقول لك اني مريض بالاسمه واني اخاف على روحي، اني عندي مشكله بالرئه، فاني اخاف من الكوفيد 19، اريد تعطيني N95 هذا اذا انطيه اني اصلا التنفس مالته راح اسويه صعب. This is important point. Okay. All FDA cleared N95 respirators are labeled as single use. تستخدم مرة واحدة. Disposable devices. إذا تدمر، إذا sold، إذا يعني damage، لازم إحنا شو نسوي؟ discarded. Okay. N95 respirators are not designed for children or people. يعني واحد خايف على ابنه والطفل مالته ما يجي يشتري لي أنا N95 والله أخاف عليه من الكوفيد 19. هذه أيضا نقاط مهمة جدا يجب أن يعرفها الناس، لأنه هي ما يصير. أيضا شوف، أنا بالنسبة لي هذا أوكي، هاي اللحية، هذا الفيشل هير، هذا معيق إلى N95. اوكي، لانه هذا راح يترك جاب. هذه نقطه مهمه. هذا لحيته خفيفه، اكو لحيتهم ثخينه، اذا يستخدم N95 ما راح يفيده حقيقه، راح يترك جاب ويفوت من عنده الفيروس. اوكي. What methods can be used for decontaminating masks؟ بدأنا نسمع على انه N95 من الممكن تعقيمه واعاده استخدامه. طيب انا شلون يعني اني لمن افهم بهاي النقطه؟ هل من المعقول انه اي شيء استخدمه؟ No. 3 different methods that seemed the best. One is UV light, the second one is hydrogen peroxide, vapor, not solution, vapor. And the third is moist heat. What methods do not work for decontaminating masks? This is also important because some people عندنا مرضى يجي يقول لك انا ال N95 اجي اطمسها بالكحول واطلعها تيبس، او قسم من عندهم يخليها يوم راسه بالليل يطمئن عليها يقول لك ثاني يوم اني استخدمها. This is wrong way. We have to educate people. We have to educate patients. Okay. So publishing brochures, how to use PPE is very important and a critical point, such as the following one. This is a brochure, okay, how to wear gown, a mask, goggles, facial, gloves, and so on, and how to get rid of them, how to take off them. Also, those are simple but important, very important to prevent contamination and to prevent spread of the infection. Okay, another good and important point is how to use disinfectants. This is another critical point because people do not know what is the exact disinfectant that work against coronavirus. This is an important point that people do not understand. So we have 2 types. We have cleaners and disinfectants. Cleaners will push away the germs but do not kill them, while disinfectants will kill them. So we have to educate people what is the exact disinfectant, what is the safe disinfectant, and how to use it. Okay. So people may go to the grocery, to the pharmacy, to whatever, to the supermarket, and they say they saw a lot of disinfectants and the cleaners. So they do not know what is the exact choice. Okay. So farmers' contribution here is what? The suitable disinfectant, the right dilution for the disinfectant, the right procedure, and prevent toxicity. So, showing a lot of information can make anyone satisfied with what is he's reading. This is concerning the advertising of disinfectants in supermarkets, in websites, in Facebook, okay? We have to educate them by contribution for what to choose. Another good point. What about the lifespan of this virus on the surfaces concerning copper, cardboard, stainless steel, plastic, and inside the air? This is important. We have to give good information and correct information to prevent the confusion of our people. Concerning using hand gel or soap, what type of hand gel must be used and how can be used? Some people believe that they know everything and it is just a simple daily habit. This is not correct at all. So what type of hand gel and also what type of soap? Is it important to use only medical soap or even any ordinary soap? Such advices seems to be very simple and well known, but in fact they are not and need learning. Another good important point, which is prevent gathering. What do you mean by gathering? We just say, please prevent gathering, put a good distance, a social distance, okay? No kissing, no hugging, and so on. This is because that the information available on satellite channels, websites, social media posts, and even some unauthorized health organizations and staff are not correct and make the people confused. In addition, the information must be up to date due to lack of previous and confirmed information concerning the virus. احنا بدنا نغير معلوماتنا، بدنا نسوي ابديت دائما. الصيدلي يقرا ليش؟ يوميا يطلع معلومه جديده، فالشيء جديد غريب عدو مخفي كلها صار لها 6 اشهر او 5 اشهر، ما عندنا ليش المعلومات المهمه والقويه والكونفيرند اباوت ات، فلذلك لازم نسوي ابديت. هذا الفارماسيست يقرا. اوكي. So what do you mean by prevent gathering? What do you mean by social distance? What do you mean by airborne disease? How we can cover cough and the sneeze? How can I get rid of use PPE? Prevent visiting elderly people. هذه نقاط مهمة جدا. يعني شوف if you want to advise people not to gather, what does it mean? It is not sitting too close. So again, what is the too close? Okay, this is important point. Okay, when you feel a sneeze or a cough coming on, covering your mouth prevents the spread of infection germs. هاي نعرفها واحنا من أنها أطفال بالعلوم يعلمونا، لكن كلنا let me speak Arabic please. كلنا نعرف بأنه sneezing coughing احنا نسوي هيك، مو صحيح؟ هذه نعرفها. أنا قبل 3-4 أشهر يلا بديت أتعلم إنه السنيزينج والكافينج like that. okay, this is culture. هذه ثقافة يجب أن نعلمها للناس، لأن إحنا كلنا نعرف إنه إذا نعطي شيء حتى لو لابس gloves, although we are wearing gloves and sneezing just like that, okay, راح أسوي الانفكشن. هذا شو حسوي أنا؟ إذا أنا واقف بالصيدلية واعتصمت بهالطريقة، أخذت الدواء وطيته للبيشنت وأنا بيه شنو؟ بيه كورونا فيروس، إذا إيش راح يستفاد البيشنت خطية؟ راح نقله. هي مو مجرد أنا لابس gloves يعني انتهى كل شيء. هذه ثقافة يجب أن أعلمها للبيبل. Okay. Educate waste equipment management. It is a critical point in which the pharmacist must learn people and medical staff how to get rid of waste products to prevent spread of infection, especially at hospital that has quarantine. Okay. Installing educate pharmacies. الصيدليات نعلمها installing high efficiency filters, increasing ventilation rates in the work environment, installing physical barriers, installing a drive-through window for customer service. هاي من الامور اللي بدينا نشط احنا في نعلم الصيدليات ان يحطون بلاستيك شيلد، ان يمنعون دخول البيشنت للصيدليه، ان يسوون فتحه ويندو صغيره. هذه كلها امور مهمه. أنا حتى لو فارماسيست وأفهم كل شيء وأعرف كل شيء، إذا ما أطبق هذه الأمور ما راح أفيد البيشنت، بالعكس راح أسوي سبريد أوف ذا انفكشن، لأنه إحنا الصيدليات قد تكون هي مركز للكوفيد 19، مو صحيح؟ لأنه بيشنت هواي يطبونه ما نعرفهم شنو. طيب the final mission for the pharmacist nowadays is supplying, which is very important, ensuring adequate storage and supply of appropriate stocks of relevant medicines and other medical products and devices to supply the demand. احنا كفارماسيست عندنا بصيدليات وعندنا ايضا نعمل بالمستشفيات، يجب ان احافظ على الموجود عندي من الادويه. انا مو بس عندي بيشنت هو ياخذ بس يجي احط له اعطيه ماسك واعطيه جلوز واعطيه معقم واعلمه، لا 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 لا، انا عندي بيشنتس، هذول البيشنتس خطيه يجب ان اوفر لهم الدواء واحافظ على موجودات الصيدليه من الادويه، بالذات for chronic diseases. This is very important. اوكي، هذه يجب ان افكر بها واعمل منها ل3 أشهر قادمه، انه يجب ان اوفر هذا الدواء لمرضاي. Treatment information. Okay, this is also a good point and a critical point. Pharmacists must be up to date with the treatment information for COVID-19, because currently there is no specific medicine or vaccine for COVID-19, and no medicines or vaccines have been fully tested for safety and efficacy. We hear a lot of information, fake information, confused information, antibiotics, vitamins, herbals, corticosteroids, hydroxychloroquine, azithromycin, caltrate, tocilizumab, and so on. Okay, those information must be filtered, okay, and translated to our patients and the public to know what's going on, okay? Because there's a lot of information, a lot of fake information that will confuse the public. Okay. I'm a pharmacist and I have a scientific background in different categories or knowledge of pharmacy sciences. So, can I prepare hand sanitizer gel? Why not? Yes. What you need? Okay. This is the formula how to prepare a hand sanitizer gel. It is so simple. Okay. So I don't have to say that there is a bigger problem. There is no hand gel. It is a crisis. I cannot any hand gel in the stock and so on, or in the drugstore. No, I can prepare it. Okay. Can I prepare hand disinfectant solution? Yes. Why not? If I have ethanol 80%, if I have ethanol 90%, I can prepare hand disinfectant solution because I'm a pharmacist and proud to be a pharmacist. Okay. Finally, pharmacovigilance is very important because I have to educate people, to educate patients, not to take any self-medication. They read about it in the websites, in the Facebook, a post from WhatsApp, and so on. This is very dangerous, and I have to be a reporter for a pharmacovigilance because I have to report any problem, any drug interaction, any use of herbal, any medication, and so on, just to protect our people. And thank you very much. وشكرا جزيلا.
Can start. Thank you.
Let me begin by thanking the Merck company. Let me just begin by thanking the Merck company for the invitation to join you this evening. It's fantastic to think that I'm sitting in the UK and you're in Iraq and we're speaking to each other. The picture, that actually is the last slide. Hold on. Let me go to the first one, shall we? Yeah, okay. The picture you see before you is Edinburgh. It's my home city, and that's the castle in the background. And then we have the clock tower here. Hold on, let me just laser pointer. Yeah, we have the clock tower here. We have the university down here, and we have the College of Physicians to your right. So, very famous city with 5 universities. Now, I've been asked to talk about advances in the technology for patients with diabetes. And I'm very happy to do this in a few minutes. But I'd just like to touch on COVID-19 and to follow up on Professor Kaider's presentation. I mean, it's an issue that's important to those with diabetes because if you look at the underlying disease of many patients who present with the coronavirus, many of them have, in fact, diabetes. Diabetes, as you know, is a chronic illness, and it puts the patient at excess risk of cardiovascular complications. But in this case, perhaps because of the obesity and other risk factors, it also puts people at risk of a very poor outcome if they get diabetes. So I'm just going to spend the first 3 minutes on this subject of COVID-19, and particularly how it relates to diabetes in the UK. Now, let me just say at the beginning, I've got huge respect for the pharmacists because you truly are at the front line, and every day you're face to face with the patient. Many GPs in the UK, your only contact with them is by telephone, but with pharmacy, the pharmacist is one contact professional that you have access to, and you can get very valuable advice, which is what Professor Haider just told us. Now, when it comes to diabetes and COVID-19, I think we need to realize that diabetes is a chronic illness, and those with diabetes and who develop symptoms of COVID-19 are at particular risk, particularly those over 70. And remember that patients with diabetes are not actually at increased risk of infection from COVID-19, but are at increased risk of poor health outcomes if management is poor. So diabetic patients should be checking more frequently their glucose status, particularly to avoid hypoglycemic episodes, which of course can be brought on by infection. GPs in the UK are urging patients not to neglect diabetes care, but face-to-face appointments have been replaced with phone calls to minimise social contact. Hospital outpatient visits in the UK are continuing for special cases only. Otherwise, again, it's by phone. I think the feeling is that if you go to a hospital, you've got a higher risk of getting the coronavirus. So better to stay away from hospitals. And in fact, our accident emergency departments in the UK are underutilised just now because patients are just not going and utilising other facilities within the hospital. Hospital treatment does continue, however, for those with heart and renal complications, but where possible, patients are sent home or to care homes. And in many of these cases, there are need for shielding, so the patient really shouldn't leave their house for upwards of 12 weeks. And patients being reminded that drugs like paracetamol, acetaminophen can alter the continuous glucose monitoring sensors. So finger sticks should be used to ensure accuracy. That's something that maybe pharmacists could reinforce. Now, every day I've been following this, and you can see on the left of your screen are the number of deaths reported in Iraq. It's 80, and there's been reported 1,434 confirmed cases of the coronavirus. That's a tiny, tiny number. In the UK, we have about 850 deaths every day at the moment. So our total is 14,576, and there's 108,000 confirmed cases. So there's a huge difference in magnitude between Iraq and the UK. Now, moving away from COVID-19 onto diabetes, let me just remind you of the technological advances over the last 50 years. First of all, is the use of the glycated hemoglobin test. That was actually pioneered in 1977, but it didn't actually come into routine clinical practice until the early 1980s. Then, of course, it wasn't so long ago that we had to use animal insulin, but now we have human insulin. And then there was the availability of modified release tablets. Old favorites like glycoside from Diamicron or metformin glucophage were made available as extended release forms to try and reduce the pill burden. And then along comes fixed dose combination tablets. Glucovance actually was the fixed dose combination that proved to be the pioneer, if you like, of fixed dose combinations fixed for controlling blood glucose, not blood pressure, but blood glucose. And in the US, the FDA have just approved a triple combination therapy of empagliflozin, an SGLT2 inhibitor, of sitagliptin, and of metformin. And then we have the availability of these continuous glucose monitoring systems or flash devices. Maybe you've seen the Freestyle Libra. Hello, Fahad? Fahad?
Yes, Professor Hari. Please, can you reshare your screen again?
Right, here we go. Yeah. Share your desktop or?
No, sorry. Yeah, share your desktop.
Or share your window, share your desktop. Right. Okay. There you go. Give control. I think you should have control now. Yeah. Yeah.
Yeah.
Yeah. Is there a problem, Fahad?
Yes. Take me 1 minute.
Apologies to those listening. When it comes to social distancing, Professor Kaidar was saying that the public generally don't know how far to stand apart, but we have a rule in the UK that you should apply the 2 metre part. So when you go to supermarkets in the UK, you will see the signage on the pavement on the road telling people what the distance is between, or 2 metres between where you should stand. Hello?
No, okay, go ahead. Yeah, no, okay, go ahead, Professor.
So do you want me to go through this slide again?
Yeah.
Yes?
Okay. Yeah, yes, go ahead.
Right. Oh, sorry. So technological advances over the 50 years. We had the use of the glycated hemoglobin test, introduced in the 1977 time, but not used routinely until the 1980s. Then we had the use of human insulin in the early 1980s. Of course, prior to likes of Humulin, we had to use animal insulins. And then there was the availability of modified release tablets to try and reduce the pill burden. Along comes the fixed-dose combination tablets. Glucovance was a pioneer by bringing 2 drugs together to control blood glucose. iGRD XR is the latest triple combination tablet to be licensed in the US, and that's going to be, I guess, licensed in many other countries with 3 tablets, 3 ingredients in the same tablet. Then we had the availability of continuous glucose monitoring systems, flash devices like the Freestyle Libra that measures interstitial glucose in your arm. And finally, there is a move away from injectables to oral forms. And semaglutide is a GLP-1 receptor agonist, available as an injection, but now we have an oral form of this. So something we've tried to do with insulin, but not really successfully. But there is, as I say, with pharmaceutical advances, we might see more oral therapies moving away from the parenteral ones. So I want to give a focus on the oral therapies with metformin in recognition of Merck's interests. Metformin really ticks all the right boxes for managing type 2 diabetes. There's a huge extensive database on the product, and there's an evidence base that's most extensive for all the therapies that we use for managing diabetes. It's been used in landmark trials. Of all the current cardiovascular trials that are ongoing with the neuro agents, the background therapy is nearly always metformin. It has worldwide guideline support. It's compatible with all other therapies. So it's got universal usage with any other treatment for managing diabetes. So there's really very few incompatibilities there. And health benefits, of course, can be achieved at low cost. And it's suitable for most patients due to relaxed prescribing information. We can give metformin now to patients with renal dysfunction and chronic kidney disease, stages 3, 4, and 5. So metformin is not a helper or adjuvant drug, and sometimes it's described as that in the Middle East. It's, in fact, the core therapy for managing diabetes in 2020. Now, we get some idea of how many patients are receiving metformin by going to all these clinical trials. And we can see here, hold on, I've lost the laser pointer. You can see here all these trials that have been published the last few years. They've all got acronyms there. And down at the bottom here, we've got the number of patients who are in these trials that are on metformin. And really the messages across all these trials is that about 4 in 5 patients that are being exposed to the newer agents, they're all on a background dosing of metformin. Now, metformin enjoys endorsement by all the international worldwide guidelines managing diabetes, and this is the ADA and the EASD, and most physicians in the UK and Iraq, all follow these guidelines. And you can see here that the first-line therapy is metformin with lifestyle. We never, ever forget the benefit of lifestyle change. So first-line therapy is metformin and lifestyle. And if you look in the review paper, you'll see the metformin has got high efficacy, no risk of hypoglycemic episodes. It causes either a very modest weight loss or has no effect on weight, but it doesn't add to obesity. The cardiovascular benefits are there. It has a benefit in reducing the risk of atherosclerotic cardiovascular disease, ASCVD, and the cost is low. So these are all the benefits that follow with metformin. Now, the one downside to metformin is that you need to give the standard tablets 2 or 3 times a day to improve tolerability. And the tolerability issue and the fact that you have to give the drug 2 or 3 times a day raises the issue around adherence. So you might understand that for standard metformin, this is a profile of the plasma concentration of metformin over 24 hours. And you can see when you take a standard metformin, it enters the stomach and the disintegration, dissolution takes place within 15 minutes and the absorption is fast. So you get this quite sizable metformin peak in blood levels, and then it falls away. And what we're trying to do is to delay the absorption and maintain systemic exposure to metformin over a long time. So it's a bit like the COVID-19 infection rate. What we're trying to do is to flatten this curve and then extend it out longer. So this is the formulation of Glucophage XR, this modified release form of metformin, where we've got 2 insoluble polymers. One contains the metformin, you can see them here, and there's another insoluble polymer outside that doesn't contain the metformin. And the polymer with the metformin, it releases these particles of metformin, and then they have to find their way out of this tablet, and that takes time. And this is now how we see the 24-hour metformin blood glucose concentration profile. And you can see with what we've done here is to flatten this curve with the extended release and then extend it over a 24-hour period. That's really exactly what we want to do with the COVID-19 infection, so that we don't place a true burden on our health services. Yeah, so that overall the patient is exposed to the same metformin drug levels, but it's just a different pattern of release. And does that translate into better adherence? Yes, it does, because of better tolerability. I haven't got time to show you that. But when you switch patients from metformin in the green bar to the XR in the blue bar, we see an increase in adherence here, quite significant increase in adherence. And moreover, we see a reduction in HbA1c, what you would expect. The two follow each other. So switch over from standard metformin to the XR improves adherence in a routine general practice, and that should feed through to better outcomes. Yeah, and these are some of the forms that we see in the UK here. We don't call it XR, we call it SR for sustained release in the UK. And then there's diamicron MR, modified release tablets. So advances in technology with a view to reducing and simplifying the tablet burden. Now, one of the other advances, of course, is the availability of fixed-dose combination tablets. Again, all to do with reducing the pill burden. And it is true that when pharmaceutical companies put two agents together in the same tablet, the same envelope, in fact, the safety and efficacy profile is no different than if you were to take these two agents and administer them together, co-administration, rather than as this fixed dose format. And that's true for nearly all fixed dose combinations, except for glucovans, where the opportunity has been taken, in fact, to try and improve efficacy and safety. So we don't just have equivalence, we've got a superior outcome for this fixed dose formulation compared to just giving a co-prescription of standard metformin together with a prescription for glumenclamide. Let me remind you that in all these cardiovascular outcomes trials, 1 in 2 patients are currently treated with sulfonylureas, so they're well established, but they still have a role to play in managing diabetes. So it's worth remembering that. So fewer tablets should improve adherence. You will end up getting better glycemic outcomes, and fewer long-term complications should follow on. Now, with this combination tablet, glucovans, here is the metformin is no different in glucovans to standard metformin, but the glumenclamide is, and we can see the pink is a standard glumenclamide tablet with a peak levels, this is plasma glumenclamide we're following, peak levels about 7 hours. Whereas the glumenclamide that's released from glucovans leaves the tablet much, much sooner. So that helps to lower postprandial blood glucose, and moreover, you see a diminishing decline in glumenclamide levels with glucovans, meaning greater or reduced risk of hypoglycemic episodes, both less postprandial hypoglycemia and less nocturnal hypoglycemia. So just by changing the kinetic profile, you ought to be able to get better safety and, in fact, better efficacy. And how that's been done is by taking a standard glumenclamide tablet, here it is, and it has a particle size range between 10 and 100 microns. The absorption is slow. Whereas with glucovans here, the glumenclamide particle size is much smaller, and it's a controlled metered release tablet. 75% of the particles have a micron size less than 21, so the absorption is much faster. So it's how the glumenclamide is formulated gives us this advantage over standard glumenclamide. Moreover, if you take patients on standard metformin and standard glumenclamide, which is the case here, you take their HbA1c and then you switch them to the fixed dose combination tablet, and once again take an HbA1c. We see the outcome in the next slide, that for all patients there was an improvement in HbA1c here of about 0.6%. If we take patients with a high baseline HbA1c, that improvement is amplified at 1.3%. So just a switch brings about an improvement in glycemic control. There are plenty of commercially available fixed dose combinations. there's Janumet, Lugavance, and then there's Dunjardi, which is metformin and empagliflozin. Some of these names, brand names, may be familiar to you, some may not. Each country seems to have its own brand name. So, conclusions. Better outcomes in the diabetic patient can come from judicious use of established therapies with advanced formulations. Pharmacists are important in delivering personalized therapy for the individual, and combinations of therapy are needed for most patients. Fixed dose formulations have the potential to improve adherence. Some are designed to improve efficacy and safety outcomes like Glucovance. I think that just about brings me to the end. So I just thank you for listening and hope that we get an opportunity to meet up in Iraq or the UK in the not too distant future. Thank you.
Thank you, Professor Howlett. You are most welcome to come to Iraq anytime, of course. So at the end, health workers and pharmacists are part of this healthcare system, are in the front line of COVID-19 outbreak response, and such are exposed to hazards that put them at risk of infection. These hazards include pathogens, exposure, and also maybe long working hours. So there is a rationale for use of personal protective equipment like masks. A lot of responsibility also related to patient education and society commitment toward our people. We hold the responsibility to deliver effective, safe, and quality medicine, especially at this critical period, and for optimal health outcome. At the end, I would like to thank you for attending this meeting and also deep appreciation to our speakers, Professor Howlett and Professor Haidar Tekmechi. Wish you good health to you and your family and your beloved one. Thank you all and bye-bye.
Thank you.
Thank you.